right now, there are no hard and fast rules with what CMS states for the actual number for excessive locations. As Ania mentioned, they've thrown out different numbers, 11 addresses or more, 13 addresses or more, 15 addresses or more. And what we at Quest have seen CMS do with things in the past is they'll kind of bring up a topic for several years. They'll look at it from different angles while they're trying to determine what their approach is. They may discuss that or mention the issue in the annual call letter and allow plans to respond to it, maybe do some studies, and then slowly start to kind of work towards what their final response will be or requirement will be. And that's kind of what we feel like they're doing right now with excessive locations. It's definitely not something that's going to go away. They definitely have eyes on it. We think at this point, they're just trying to determine what that long-term answer will be around maybe certain specialties, allowing different numbers of locations, or do they just say for any individual provider, regardless of specialty, for practitioners, regardless of specialty, do we just say there's a specific number? I think they're still evaluating all those things. But again, we anticipate at some point they will come up with an approach, and it may be a staged approach where maybe they'll say the number is 15 for several years, and then maybe they'll start dropping it down to allow plans time to kind of address the data, the worst offenders in their data to get to that threshold of 15, and then maybe they'll stage in a lower number and a lower number. We have in the past, years ago, heard them mention the number of 5 addresses being, acceptable up to 5, and anything beyond that maybe being, really unreasonable. So we would not be surprised if at some point they get to that number of 5. So, our strategy is work towards that 5, but you can do it in a staged approach of being able to identify the worst offenders for the number of excessive locations in your data and start working through those, because it is, we realize, a large lift to address that and identify which locations are actually accurate and which ones are not.